Ho ho ho, everybody. I just got off of a consult. I feel like I'm talking about it all the time. I feel like other people are talking about it a lot. So I just wanted to be a little bit louder about it because this gal has been bounced around through a lot of different people and everyone's saying she's fine and no one has looked at her neck. So let's just kind of refresh on some basics here. Concussion, the physics of concussion, the linear acceleration of concussion happens between 70 and 120, 60 to 160. You'll see a different range, but 60 to 160 captures it all. Somewhere between 60 and 160 G's of concussion is going to happen. Whiplash, cervical strain, sprain, neck injury is going to happen between 4 and 5 G's. On your way to concussion, you have whiplash. Another little logic thing for the clinicians out here. Your brain sits in here. On top of here, what is that connecting piece? That's your neck. So you have to have acceleration deceleration for concussion to occur. It's an acceleration deceleration injury where the white and gray matters, different densities, stretch and shear, nothing tears or bruises, but you get this functional stretching and shearing of the brain, which leads to a neurometabolic cascade, which is concussion. For concussion to occur, you have to have whiplash. So we've kind of hit that point several times now. So let's get into the concussion exam. Like, this person has visual symptoms, this person has vestibular symptoms, this person has headache, this person has autonomic symptoms. We're running a VOMS on a patient and we get to the vestibular portion of the VOMS where we're doing horizontal and vertical VOR. So I'm going to look at a target and I'm going to wag my head no at a pace of 180 beats per minute, and then we're going to go yes at 180 beats per minute, and I want to point out the elephant in the room. Your neck is moving the whole time. So when we're doing that's really getting me dizzy and weird, or that's really provoking my headache, if we're not comparing it to other tests, VNG, caloric testing, head impulse testing, is it really a purely vestibular issue, or is it maybe a little bit of the neck too? When we've done vestibular therapy and we've cleared vestibular therapy, but we're still having these delayed symptoms, maybe it's the neck. The other piece I want to point out is when we look at concussion versus whiplash in studies, particularly I think the studies of hockey players, we can't tell the difference from mechanism of injury and symptoms. We can't tell the difference between concussion and whiplash. All the mental, physical, cognitive, emotional symptoms of concussion will show up in a neck injury. I even shared about it in a post recently here where they're like, we really got to look deeper at these people having longer symptoms. And I think it was something I don't remember the percentage off the top of my head, but it was something like 86% of participants in the study with PCS had significant neck involvement. How are we still not managing this in the concussion space?